Secondary AML includes therapy-related AML, but also AML with an antecedent hematological disorder. In the last year, we had two diagnostic classifications that are the 2022 WHO diagnostic classification, but also the international consensus classification. And they both explain in a different way the concept of the secondary AML, because regarding the WHO 2022, we have a newly segregated entity in which we can have secondary myeloid neoplasm post-cytotoxic therapy, for example, post-chemotherapy, but also post-therapy with PARP inhibitor. But we also have secondary myeloid neoplasms, and so also secondary AML to germline predisposition with that list of genes that we expected to see increased over time. On the other side, the ICC defined a secondary AML as a diagnostic qualifier that are therapy-related AML, AML with germline predisposition, or also AML with an antecedent MDS or MDS-MPN. If we want to extend the concept of the secondary AML, we could also have some differences regarding the previous diagnostic category that are the AML-MRC, myelodysplasia-related changes. In particular, in their inclusion criteria. For example, the dysplasia that is eliminated, but also the antecedent MDS diagnosis is also described in the 2022 WHO classification. And on the other side, we should have different subdiagnostic category in both the 2022 classification and in the ICC. In the ICC, we have three different subentities that are the TP53 AML subcategory, the AML with myelodysplasia-related gene mutation, and the AML with cytogenetic abnormalities. On the other hand, the WHO 2022 also have a new unique entity that is the myelodysplasia related with both cytogenetic abnormalities but also the 8 new MDS related gene mutation. And the most important difference is related to RUNX1 mutation that is present in the ICC, but we also have some minor points concerning the cytogenetic abnormalities. So it is essential in order to have a proper diagnosis of secondary AML to catch these differences among the two different diagnostic classifications.